Recording is in progress. Hi, good morning. So please bear with us a little. This is our first time actually having a hybrid event. And so, of course, there are people coming in, there are people here, there are people online, but we're going to stay as focused as we possibly can. This is October's Beyond the Gift Card Community Conversations, with special thanks, of course, to Northwestern's ARC for their seed funding to continue these conversations. We began these conversations actually in March of 2024, and they are designed around 4 pillars. Thank you for advancing. So actually, I'll take a step back. Project Erase is equitable research and community engagement. This was actually what prompted us to start these conversations. There was a pilot survey that was released to community and faith-based organizations just to assess their familiarity with research, to learn more about how they're using research, and to also learn more about the population served. We have to admit, their population served. And what we found was that most of these organizations were familiar with research, yet they were not engaged in research partnerships. So that was interesting. We also found that most of the organizations were familiar with surveys and focus groups, but not really familiar with how the community-based organizations could drive research. So our conversations revolve around 4 pillars: research and program design, research and evaluation, research and data collection, use and analysis, and community-driven research. And next, please. So just quickly, why? Why are we conducting these conversations? Oh, I'm sorry, if we go back, just one, go back one. And it's for 2 reasons: to prepare community and faith-based organizations to equitably use research in the delivery of programs, services, and ministries. And then also to prepare our same grassroots organizations to actually begin to initiate community-driven academic research partnerships. So if you missed any of those other conversations, they are available online on the same website. Hopefully you've had a chance to take a look at them, where we're talking with researchers. Most of the researchers that we are talking to have been just, one, very easy to talk to. They are already community-minded. So we want to just emphasize that this is a very safe space, that it's a transparent space, it's a community-hosted space. We want to respect everyone's opinions and just move forward. So today I'm excited to introduce Dr. Susan Tran, who is going to actually discuss a study that she's initiated. So it's an active study. And as we listen, we want to think about our conversation starters. If we can advance to the next slide, please. I think we have to admit someone who's waiting, maybe. It
says turn up volume.
Oh, okay. Oh, thank you. I need my glasses on. Look.
I need my glasses on.
Okay. Great. Okay. So we want to think about potentially how can Dr. Tran's findings, how can they influence the work that you're currently doing with youth? We want to also understand who's in the room. And so that what prompted you to join this conversation. So for those who are online, if you don't mind, if you just want to drop a note in the chat, so that where you're from, your name, and what prompted you to join this conversation, and what you hope to get out of the conversation. And we will do the same here inside of the room in our new hybrid session. Okay, so I'm going to go on mute for a moment. Start here with introductions. Dr. Tran, let's see. Hello? Okay, let's see. Yes.
Hi, I'm Kathy Feast. I'm with the All Stars Project. We're a nonprofit organization, and we represent basically from poor and underserved communities in a number of cities here in Chicago. And I came because a friend passed this along to me. And one of the first things that struck me was the word pain. And so I was just like, I'm glad somebody's talking about it. And I think that's something that is experienced a lot. And our focus is development. How do you develop young people so that they can navigate the world that they're living in and all the situations and, make it possible for them to move forward in their lives and create success. So that is my passion. And so.
CC Hill, and I also passed on by a dear friend that this was happening today, and it was just a topic. Again, youth also ages 6 through 18, and the organization that I work for, Uniting Voices Chicago, we always look for reasons, or not reasons, but we look for ways to work with the youth and understand and provide resources for them and just be that passing hand so that they have every opportunity that they deserve as youth and for them to further in life. So this was just a topic, very interesting, and what will be said and discussed will probably be very useful for us in our organization. So.
Good morning, Tamika Gavin. It's interesting because I have sat in room email chain with you, CC,
Yes.
and Kathy. I've been in a room with you. I was forwarded the email by Ms. Josephine Robinson because I'm a co-chair of the Craving to Success Coalition. So that's how I got involved. Also, I'm a site director for the Union League Boys and Girls Club. So youth development is just my everything right now. And I am really excited to be here to learn more, to take both to the coalition and back to the community-based organization.
Great, thank you all. Thank you. Great. Absolutely. So without further ado, I'm going to turn the floor over to Dr. Susan Tran.
All right, can you turn your speaker off?
Well, I'm on mute.
No, turn down.
Thank you. Okay, let's see.
Yeah.
All right. So our volume is off on our computers, so we don't get feedback. So if you have anything that you want to mention on the Zoom, then please put it in the chat so we make sure that we don't lose your comments as well, because we're so pleased to have a presence online and in person here. So I'm Susan Tran. I'm a professor of psychology at DePaul University, and I'm a pediatric psychologist. So what that means is that I work with kids who have chronic medical conditions or are managing different health behaviors. So I work with kids on making sure they take their medication, can get good sleep. And a big focus of my work has been on managing pain. So I'm really excited to be here to talk about what I know in this area, what I'm hoping to do, and brainstorm with you all some next steps on how to advance my research in a way that really is meaningful to you and the work that you do. All right, so a lot of times folks aren't familiar with what chronic pain in teenagers may look like. I feel like we kind of know what chronic pain in adults looks like, but some folks aren't aware of what chronic pain might look like in teenagers. And so chronic pain in teenagers can look like all sorts of different things. It can look like headaches that come on again and again, like migraine headaches. It can look like stomach aches. Musculoskeletal pain or back pain. It can be related to an injury that persists for time after time, or it can be related to a medical condition. So it can be related to sickle cell disease, Crohn's disease, arthritis. Kids can get all of those things, and that can cause pain time and again. Chronic pain is pain that comes back. So it doesn't have to be constant all day, all the time. But if you have headaches week after week, that's chronic pain. So we're looking at pain that lasts 3 months or longer, and it's actually fairly common in children and adolescents, more so in adolescents than in children. As we get older, more people are likely to experience chronic pain. But some estimates are research puts estimates that like 20 or 40% of youth will have chronic pain at some period, right? Maybe they have an injury that persists and then eventually gets better, or maybe they have migraines that persists onto adulthood. So a lot of times pain can persist for years and years. Sometimes it's related to an illness or an injury. We can kind of pinpoint where pain started, and sometimes it's more difficult to figure out what started pain. What we do know is that, it can start for a number of different reasons: illness, injury, some other type of inflammation in the body. And sometimes those nerve signals just keep persisting after an illness or an injury has resolved. Right? So you might have an injury and the imaging all looks good, but you still have pain. And those nerve signals are still sending messages. And a lot of things can maintain pain, like stress, trauma, anxiety, depression, other health behaviors can maintain pain or make it worse over time. And so we know that this, our youth are experiencing all of these things. And so they're at risk for increased pain. And it can persist throughout adulthood. Kids who have pain as kids are more likely to have pain as adults. Why is it important to study pain? I mean, I think everyone has experienced pain and know what it's like when you have pain. It gets in the way of doing things. And so for kids who are experiencing pain, good morning. For kids who are experiencing pain, it might be a reason to miss school. So kids who have chronic pain are more likely to miss school. And if they do get to school, they're likely to not do well in school, right? If you have pain, you're not at your top speed, and your meetings, you can't focus, hard to pay attention, hard to learn things when you're dealing with pain. And it gets in the way of things that they enjoy. So it keeps them from doing their social activities, gets in the way of them participating in their athletic activities, their after school activities. So they're missing out on those positive things that would also be really good protective factors to help them cope with pain. It keeps them from moving their bodies well. So sometimes kids get caught, well, we all get caught in a cycle of pain where if you're in pain, you don't feel like going and moving your body. And then moving your body is painful. And then that maintains the pain over time. It also gets in the way of sleep. And that's a cycle as well. If pain is preventing you from sleeping well, you sleeping well is going to make the pain, or not sleeping well is going to make the pain worse as well. And we also know that things like stress, trauma, anxiety, and depression are consequences of pain, but also maintain pain, right? Like if you're in pain and missing out on things, it makes sense that you might be more anxious or depressed. And those types of experiences make pain worse as well. So there's a huge research base about all of that. And there's a huge research gap that I'm really interested in. So I'm a pediatric psychologist. I know how to help kids with pain. We have evidence-based treatments. There's a lot of research on what we can do to help kids, help decrease their pain, or even first improve their functioning and ability to cope with the pain that they have. However, the treatments that we have, the research that we do, the research is done at these tertiary medical clinics, these very specialty clinics that are very hard to get into, right? Even for well-resourced folks who are really familiar with the medical system, if you ever try to get a referral to a specialist and try to navigate that system, it's hard to get those referrals. And in general, folks who report pain experience more dismissal by providers and aren't always taken seriously and aren't always cared for. So there's a big gap in how we refer folks for appropriate care. And then there's an even bigger gap in how we recruit for studies on how we test whether our interventions are effective for helping people with pain. And so we know that there are huge disparities in pain care. I mean, there's lots of examples in the news and in the research that people from marginalized backgrounds, people of color, aren't prescribed pain medication the same. They aren't taken seriously when they report pain. They suffer more disabilities. When we look in adult studies and we look at people with chronic pain, adults of color have worse disability than white folks with pain. So we see that these disparities exist in adult care and in like the medical setting, but we really don't know much at all about the experience of Black youth with pain. So what is the experience like? What are they doing to manage pain? And if we have all of this great research on how we can provide good care for kids with pain, do we know that these interventions are also effective for Black youth? Because when we look at the research, right, we look at our gold standard clinical trials and we see who's included in those, they're predominantly white children from upper middle class backgrounds who are getting to these specialty clinics and are enrolled in clinical trials. So we have some evidence, but they haven't been tested and made sure that they are effective and appropriate for everybody who is suffering chronic pain. So I want to know if these evidence-based treatments are effective, and if they are, like, how do we get them out there? Like there's gaps in how we disseminate evidence-based medicine everywhere, but specifically with this population where we have no research, I'm really interested in making sure that we have appropriate treatments and that they're accessible. So the study that I'm currently conducting is trying to understand this experience better. So I'm here to build some relationships with folks. I'm really interested in getting that community input because the reason that, one of the reasons I think that this is so poorly understood is that there's no research in community clinics, right? The research is done at these specialty clinics that experience all of these barriers to care. And it's really difficult to get enrolled in these studies. And it's a burden from participants to participate in studies. So you all work directly with the youth. And so you see what they are doing day to day and the struggles that they have, the challenges that they have. And so I'm really interested in understanding from you all, what do you see as some of the needs and what are the experiences of some of the youth? So I can better understand this and understand what resources are even needed. Right? I've got like my toolkit of evidence-based practices, but like, what good is that if I don't know what the actual needs are in the community? So I'm hoping through these relationships, I can assess the resources that are already existing. I mean, people do all sorts of things to manage with the challenges that they have. Maybe they have family members or healthcare providers, friends, other supports. Your community organizations may offer supports for all of these youth. So what are those resources? And then what are the gaps? Like, where does that resource kind of end? And what else do we need to fill the gaps in supporting youth with pain? So I'm aiming in this part of the study to conduct interviews with any of you, really, like anyone who can tell me what are the needs. I would love to talk to teenagers with pain, their family members, but also community providers, healthcare providers, organizations that can really identify like what are the challenges that are faced by this population and what are the gaps here. The ultimate goal is to build some partnerships and get a really community-driven idea of what is needed. Now, I can come and I can say, this is the research that we have, and these are the interventions, and these are the resources that are needed to provide these interventions. And you can say, this is the need, and this is what we have, and this is how it should be delivered so that it's accessible to the population that needs it. So I'm hoping that through a partnership and the findings of this initial MyCARE study can tell us what are the resources or supports that are needed and how do we get there? What are the next steps to make sure that we are building something effective and accessible? So I've got a few handouts and QR codes and links that I'm gonna share. So one thing that I'm asking is if this is something that you feel like you've got something that would be helpful, then I would love to have you participate in this study, right? I will reimburse you for your time just to have that conversation about what are the things that you're observing, what are the experiences, the resources and the needs. And then I would like to figure out like, what are the next steps, right? I think some sort of community advisory board would probably be most helpful so that we identify together what those next steps are and we continue the conversation, not just a one-time where I'm getting the information, but like helping figure out what are the next steps and keeping each other in the loop about how this project is going forward. Again, the hope is to collaborate so that we can co-design these resources or supports that can be disseminated to the youth that have this need. So I've got a couple of handouts today and I can share this as well. So we've put together some of this information because I think one thing is that, we have information about this. And I think sometimes that's part of the piece is having the conversation and knowing that this is an experience that people have and that chronic pain is something that can be managed and that there are tools out there. So this is one info sheet that we have just on like what is chronic pain for adolescents, What can we do about it? What's the language that we can use? How can you access providers or talk to health providers? If you think that that's a good step to helping manage the symptoms that you're having. And then this is the flyer for my study. So I've got a handout here and I can share online as well. So we're conducting this study again to learn about the resources and needs. I have the QR code on the left is a video just of me basically saying all of this on why this study is needed. And then a interest form, a short Qualtrics for survey just with your information on the right so that I can reach out to you and get you enrolled in the study. All right, that's all my information. So much for your time. I saw a couple of things in the chat, so I just wanted to make sure that we pulled that all. All right. What prompted you to join the conversation? Would you like me to read this? Okay. All right, so Tammy Martin, Grace Sister to Sister Org, joined because the organization serves young ladies ages 10 to 17, anti-bullying workshops, community service or opportunities, and social emotional learning. Dolores Allen, serve youth through our financial fitness program. Gabriella Matthews is here. Evelyn Austin, Grace Sister to Sister NFP, joined because interested in exploring, obtaining information that could be helpful. Ais Gundas from the nonprofit CIS-CRP. The organization focuses on providing the public with information about clinical research and the importance of patient diversity to learn more about health disparities and healthcare specific for research in underserved communities.
Great, and we have actually a new attendee who's joining.
Hi, Cassandra O2 Robinson, Roy Children's Hospital.
Oh, thank you. Very welcome. Great. Thank you, Dr. Tran. Are there any questions? Again, think about our conversation starters. When we're talking about at the organizational level, when you're delivering services, how do you identify youth in pain? How do you help them?
Our organization deal directly with young people in. Yeah, that's one thing. But we do go into schools all the time to make our programs available, to talk to the young people, to tell them what the program is about. And it does focus on opportunities for them to grow and develop and to learn in a lot of cases. Professional performance or, use performance-based approach. So it's not so much physical pain. I think things that come up a lot are the challenges and even emotional difficulties. But not so much from our vantage point, a focus on physical pain. So I'm very fascinated by the study and by what you're talking about, and also the gap that exists in that is the gap that we are addressing in a different way. So in terms of access and resources and, opportunities to develop.
Yes,
Anyone else?
yes, I would
so
like to.
we, since we are an after-school program and we are in the schools, so by the time they come to after school, if they've had any pain throughout the school day, pretty much the school admin handles that. And then if they're injured while they're in MyCARE, I immediately, first thing I do is pray to God that there's nothing broken, which we've had that on the basketball court. But call parents right away, and if we need to call for medical attention, that's something that we do too, just right away. Like, I just never felt that I was qualified to like super assess, what's really happening. But I'm glad that I'm here, so because I'm learning.
Mhm.
And what we deal with is the same thing. We're in the schools, we're after school. We do tend to have those occasions where we're dealing with kids that may in pain or dealing with emotional, psychological issues. And we try to assess as much as possible. So we go through all these different trainings, telling how to deal with it at that moment, but it's more so us passing on the resources and recommendations for the parents to pursue even more and further with the situation. But and that's another reason why I'm here too today, to have another resource, to have something that's more informative, because what's lacking in the 12 communities that we're in is knowing, it's the knowledge that anything is out there. And a lot of our communities, they have no idea. And mainly in our African American, Hispanic, et cetera, those areas have no clue, maybe too scared, immigrants, too scared to get the help.
Yeah.
Or have no clue, don't speak the language, in fear of, being deported. We have all kinds of issues that we deal with the organization. So, for us, it's the knowledge, being able to pass on the resources. For instance, you're doing this trial. It would be great to tell our families that. I mean, we won't have a meeting where we just like spread it all out, but we do have parents that ask us for, do you know of anyone? Who can I go talk to, I don't have insurance, how does this work? And it would be great to just have this kind of information at hand to pass on. Have a resource page. We can have a resource page that they can access. And every time we get something new, pop it in there. And they can go for it themselves if they don't want to ask questions. So,
I would like to
Do you
add,
have someone?
can you hear me?
Do you have your sound on or I can turn my sound on, I just don't wanna have like the feedback.
Okay, yes, my
Hello, can you hear me?
All right, Dolores, you have your hand up.
Okay. Yes.
Yes, thank you. My program, the financial fitness program for
I'm
youth,
not hearing anything.
even though I don't connect directly about their trauma or pain, anything like that, but I do seek out wraparound services for the youth, and I engage with the parents as well, right? Because these are minors. And so I joined this because I felt like this may be a way for me to even share information with the parents. Sometimes they start out in the program with excitement, they get going with the curriculums, and then there's a withdrawal, so to speak. So I don't try to really find, imposed, if I could say, on why they have withdrawn. I try to just keep them motivated with, positive uh, communications as possible. But as I do sense there's something going on, because even the parent, they will be very excited about getting their child in the program. And then they will go so far. And I mean, they get pretty far in the program and then there's a withdrawal. So I don't impose to try to figure out why. I just accept, their reasoning. So when so this is why I joined this call, is because I do seek out other wraparound services to help the youth and the parents. So hopefully, moving forward, this is something comes out of this that I can share with them without it seeming like I'm imposing on what's going on.
Yeah, thank you.
One of our students, I was working in New York City for many years before coming here last year, and one of the young people had sickle cell and was in pain a lot, and also wanted to perform in our program. And so I remember learning just a little bit more about it, and that there were, a lot of experimental type treatments and conversations about how family, not so much with me, but I became aware of it through his father. And he was really determined to perform at a gala when, he was like, and he literally got to release him, when you come back, like there's they're so passionate about moving forward, and it's very frustrating not to like have more information. So one of the things I was thinking about is probably learning what things are causing or what conditions are causing pain. And I think families knowing if there is, where there is any way to learn or possibly, make available to their young people. But I remember it just really frustrating, upsetting to me about the situation.
Absolutely. I mean, even sickle cell is really interesting because it's something that has a very clear diagnosis, right? So like, that if someone has sickle cell disease, they're likely to have pain crises. And yet pain is often so poorly managed that a lot of families have a lot of frustration about the treatment for the sickle cell and then the pain crises that also occur. So that's frustrating for families. And then we also see a lot of families who don't have a clear diagnosis. So then I think like that's even more difficult sometimes for those families where like you have headaches, but we really don't know why. Or you have this arm pain and we don't really know why you have it. So if you don't have a diagnosis, then like there's nothing. Chronic pain is a diagnosis in itself, but it's unsatisfying because we are always looking for like the cause. And so folks who also don't have another diagnosis like that have additional barriers to getting care. And one thing that I wonder is if pain care is so difficult to obtain, if when teenagers have pain, their parents are like, well, the doctors aren't going to help you. I wonder if like there's like a learned helplessness, like, well, I haven't been able to get adequate pain care, or other people I've seen haven't had adequate pain care. So then I do wonder about like, the sharing of information. And I wonder if it's just passively up there. I mean, I think that's great to pass along to families, but I don't know how to even be louder and be like, no, you actually you can get good pain care. You deserve good pain care. And there are resources out there. And I don't want to be pushy and say you have to get this, but I do want to like let people know that it's a resource, even if they've had bad experiences. I want to fix that and help people get better experiences and have better access to these resources.
What do you think are the other barriers to parents, families seeking this? What are the other barriers? So I mean, I know there's information, a lack of that for a lot of times, but what else do you find?
It's cultural beliefs.
That's it right there. Yeah, that's it.
Just discrimination.
Right.
Says a lot. I mean, I hear it from the kids and their families, how they feel, and why they're afraid to seek, certain things.
Right. I mean, I've worked with kids with sickle cell, right? You have sickle cell, we know you have pain, and still they're labeled as drug seeking. Like they're in pain. And so that's why they're here looking for care. And so, right, you have someone who has that experience. You're like, well, this system's not set up to help me.
Right? I've heard from many, and they say, oh no, you shouldn't be taking pain meds because they're addictive.
Right. Right.
When the doctor gives it to you, don't take them. Just deal with pain.
Right.
I hear that a lot.
Right. Right. And I think there's a lot of research to support that too, that, especially among Black Americans, there is don't take pain medication. Pain medication it's one of the tools. I'm a pain psychologist. I don't prescribe any medication, right? And we're definitely not giving kids opioids. Whatever pain medications are prescribed are typically not addictive, and are prescribed and monitored carefully. But I think that is very common. And I mean, in the climate of opioid crisis, it's understandable. But there are other tools as well.
I want to share that when I met Dr. Tran and we initially spoke about this, I shared, I think another cultural piece though, is sometimes taking pain medication is a sign of weakness. I mean, I know that at least with my dad, he had stage 4 cancer. And it wasn't until the doctor sat down with us, the pain management doctor, and she shared that you're doing more damage to your body when you don't take the medication, than when you do. And, so we had to convince him, but he was like so adamantly against it. And then there are others, right, who, think that they want to become addicted. I did want to ask, can you remind us of your timeline? And then Dr. Tran is also, she's also committed to come back to disseminate her findings so we can have a deeper conversation about how you can utilize, these findings in your day-to-day work. And perhaps that's, you've all shared by giving resources, but maybe it's potentially in program design. Is there an opportunity for that? How do you envision? I mean, I know you don't know what you're going to find, but but do you have any sort of, I don't know, speculation about how the organizations can best incorporate your findings or how they can better serve youth who they recognize are in pain?
Yeah, that's a very good question. So I've already blown past my deadline. I think it's been very difficult to recruit families with teenagers with pain. And I think I hear these themes come up again when I talk to all of you. These are things that I've heard before. And maybe if I can just count you all as participants and say, like, these are the themes that I'm hearing. So again, if you enroll and have another short conversation and just repeat what you said, then you count, and I'll rehearse you for your time to say that, because this is what I'm finding, right? Is that I feel like there are the gaps between what we can offer and who may need the services are so huge that I can't even recruit. And I feel that there are lots of barriers to engaging in research as well, right? Like, I'm not standing at a clinic, and I'm ultimately also seeking kids who aren't in services, right? So there's no clinic that is treating these kids. I'm looking for the kids who aren't in the clinic. So I'm just coming to you all like, okay, do you know of anybody? And then I hear these stories like, well, yeah, there was this kid that I worked with and this family that I worked with. And I think that's what I need to document. These are the needs. And then to brainstorm with you all, like, you're telling me about how you would share these resources. What are how can we get you the resources? Like this one info page that I have, what else do you need? Like, how can I package that better and share this information? I've got students who are helping me with the social media, because that's how that information gets shared. So I think it would be ideal if I could recruit folks by spring and bring that back to you and say, these are the gaps. And I think these are, some of the cultural things. And, what I hear is a lot of what's reflected in the literature, but none of it comes back to and this is how it affects the youth with pain, right? These are the messages that families and communities, these are the experiences, and then this is how it affects whether kids get any care for this. So participating would be very helpful. And then, yes, letting me know anyone who would be interested in partnering with designing those resources. And maybe the first step for intervention isn't my pain coping toolkit, but maybe it's the handouts, the education, right? The TikToks, which I can figure out how to do that. I can get students to help me figure out how to do that. Because I think that is probably the first step.
Yeah, I no longer work directly with youth, but I work with the care coordinators who support the youth. And I know that our care coordinators, they do a BCBA assessment, a victims of crime assessment. And so they are front line, so they would have, the knowledge that this kid may be suffering from some kind of pain of some sort. So that could be a possible pathway to getting kids referred. And then additionally, I used to work at Chicago Public School for many years, but they have parent cafes around the city. It may be a great resource for you to get connected to the Parent Resource Center.
Yeah.
And they have parent cafe talks throughout the city. And perhaps you could get signed up to go and be a speaker at the different various parent cafes.
Parent cafes through CPS.
Now they call it Parent University.
Parent University.
Parent University. I know I came late. Who's sponsoring your study?
So there is a Chicago Chronic Condition Health Equity Network. So I have a small pot of money to do this
Okay.
research.
Okay. And so it's dealing with pain.
Dealing with pain. So I'm interested in pain in teenagers. and young
Physical
people.
pain?
Physical pain.
Okay, I was under, I don't know why I thought anger. Okay, so it's pain.
Mhm. Mhm. Yeah, and the,
No.
Oh, yeah.
I'm serious. I thought it was anger. And I was really excited about that. So, I mean, not to say that physical pain is not, but you know, what we see is our young people are full of anger. So I was excited that someone was looking at, you know, how do you deal with that? And all the different ways they express it. And pain could be another way. But if you want to contact, and I'll talk to Edie about more about you, because I have great contacts with CPS and the Parent University and in terms of, you know, what you're doing and stuff. But yeah, I was just had an open house a couple of weeks ago at one.
wonderful. Thank you.
Physical pain.
I have a
only.
question. Can you hear me?
Physical pain, but there's a lot of overlap.
Okay.
Yeah.
All right,
so-
there's a lot of overlap, right? I
Okay.
mean, and so that's one thing that we see is that, you know, something fairly benign, like even a stomach ache, right? Like you can have a stomach bug. And then if you are under so much stress
Mhm.
that your whole nervous system is activated, like it's all connected. And so that's one thing that we do when I work with kids with pain is explain how pain works in the body, right? Like pain is a threat signal. Like it's a signal to your brain that your body is under threat. You have some injury or illness or potential injury, and your nerves are just sending that message. And if you have a system that's activated because of all of the stress in your environment,
Mhm.
then any little thing could set it off, and then you can have those signals just going all the time. And so that's what we see
Mhm.
is that, you know, these kids who have pain, and it's hard to identify what it is, but it's kind of everything.
Same thing with anxiety and depression.
Oh,
Mhm.
yeah.
It started causing all kinds of
Oh, yeah.
physical
Mhm.
problems that
Right.
really may not quite exist,
Right.
except that's the trigger, so.
Right. Like you, and I mean, our kids are more anxious and depressed than ever.
Oh, yeah.
And stressed and experiencing trauma, and all of that is all connected. Right? You know that when you're anxious, like you can feel it,
Mhm.
right? Like that's a physical sensation, and it's not fake and all in your head. Like it's a real sensation that you're feeling, and it's related to the stress that you're under, but that doesn't make it less real.
But your feelings are shutting down, you know,
Mhm.
it's like us being, you know.
Right.
All of a sudden you just can't do the things you could normally want to.
And I
Mhm.
know teenagers, some teenagers, they start self-medicating.
Yes.
To cope with pain, physical pain, because of the mental pain.
Right.
Mhm.
Right. Right. Yeah. We see like the whole spectrum, right? Like those who are resistant to treatment and don't want to take any pain medication, and those who are trying to figure out what to do to make it feel better.
But I appreciate you, your intentionality about focusing on this population, Black and brown youth, and normalizing these conversations for our teens. I really appreciate that. So anywhere I can help.
Yeah. Thank you. I'll come talk about it all day, every day. I think every time I have this conversation, I have like, oh yeah, this one kid that I work with. And I think that's how it starts, right? I think like if you identify folks who are having this experience, right? Like they want to talk about it because it's probably something that they've struggled with and not known what to do with it.
You know, it's interesting what you're saying, because I'm just thinking, the more that, well, we're sitting here talking about it, and the more that you're in front of people who are with young people, I think the more they will take seriously a student who, you know, it's easy to dismiss kids. Oh,
Right.
yeah, you're faking it. Yeah, you don't want to go to school. No,
Right.
you don't, you know, it's easy probably to be somewhat dismissive of that. But if you sit through something like this, and I think maybe you go further in terms of,
Mhm.
well, let me just check this out.
Right,
Let me learn
right.
more about what you're, and I think taking it seriously for young people is a whole other experience that's very helpful to them, you know?
Right, and I appreciate that because I feel like that is how information like gets out there, and we've seen it already happen, right? Like pediatric pain, right, is globally kind of understood, but like the disparities in pain, I feel like people are more aware of, right? Like the maternal mortality rates, right? The disparities that we see because Black women aren't believed when they're in pain.
Oh,
And when they report something to the doctor, right? You see it in adults all the time. And so it makes sense that if we see this in adults, we're going to see the same thing in kids, right? And if everyone's like, oh, it's just kids don't have pain, right? They're brushing that off, but the more we talk about it, the more something's likely to happen, right? We just saw that in reproductive rights, right? Like people who get IUDs have been reporting pain for years. And now all of a sudden, like, oh, maybe we'll medicate them for that. Like, and I mean, we weren't medicating kids in the 80s. Textbooks said that children couldn't experience pain. Their nervous systems weren't developed. Just like medical textbooks say that there are differences in pain perception between Black and white people. It's not true. But the more we say these things aren't true, right. So it makes sense that people don't trust the medical system or believe that there's anything to do about it because they've been hearing this their whole life.
And it's also connected to economics. I mean, I'm thinking about single family homes, like mom or grandma has to work. We don't have time to attend to your pain.
Absolutely.
Right? You better get over it.
Right.
That
Over the
is
counter.
Right.
Take some Advil, take some
Right.
Go
Tylenol.
take a nap.
Go lay down, that's just.
And honestly, that helps a lot of time. And then it's just for these kids though, that do have pain for long periods of time. And they are just like taking a nap and stepping back from activities and they fall further and further behind. But there are so many barriers to care about like the medical system is hard for anybody to navigate, like to make an appointment and to get to that appointment. And then if you're not believed, to advocate for yourself and ask for another referral. It's near impossible.
Do you have relationships with any of the federally qualified health centers?
I do not.
Because that might be something that you might wanna do. Are you from Accent?
No.
Okay, because we have one of our advisory committee members is part of the Access Health Network. And they have, I think, 30 clinics in the Chicagoland area. And they do a lot of stuff. So I'll find out and maybe you can have a conversation. Her name is she does community engagement. Her name is Regina, and she might have, because you got children are actually in a healthcare system that there might be some possibility.
Yeah.
But access, but just in general, just to Google, there are loads of federally qualified health centers. And they deal with, anybody can come, and if you can't pay, they have to service you and stuff like that. So that might be, and there are people that are already dealing with issues of pain. And I'm sure you've reached out to Laura Rita and who specializes in working with children that have chronic diseases and deal with pain. And the Cook County Health System is another place because they have clinics all over.
And one other one is Bounce. It's a very good program that takes in the families that have kids that are being treated for chronic illnesses. And they look for Bounce. They look for all types of resources to give to the families. For financial issues and everything, and even just to give them hope to just continue on. So we just hooked up with them last year, and we give them free tickets to our concerts, and families come out because they would be otherwise hospitalized for so long. And then they try to go to school, can't go to school, they're homeschooled, et cetera, et cetera. So Balance is another one, and I can actually connect you to the CEO, Joan.
That'd be amazing. Thank you.
That's wonderful. But as we wind down, sorry, go ahead.
No, she's just always looking to for different resources.
Okay.
Awesome, thank you.
We're about 10 more minutes left, or actually 9 more minutes.
Can I make
I'm
one more
just
comment?
So frustrated, I can't get on, it keeps kicking me out. So, but thank you, Dr. Tran, for joining us today. I would like to know, are there other subjects that you're interested in? We are looking at the coalition for people to join the Research Advisory Council, just to help define the content of these conversations, to make certain that they're relevant. Again, keeping in mind our mission, which is to prepare community and faith-based organizations to equitably engage in and or lead research partnerships.
I would say, if you're willing to go to some existing, organizations that are doing it all the time. So there's, for example, every police district in the city has a faith-based committee. And some of them are stronger than others, but that might be, one place that, or if there's that might be one place. And definitely, the public schools and Parent University and FACE, Family and Community Engagement, they've got a whole department in CPS. And they're really wonderful, wonderful people. And you also got, what we call community CACs. So they, and what those CACs were decided, they got involved when Rob Emanuel closed down 50 schools. So there's several, there are at least 5 or 6 that are very active. And that might be some natural places and some places where people kind of go to. So you might want to, to kind of take, because research is looked on so awful in the community, and because it's not done African Americans correct, because people do their research and then they never share the findings so that people can engage. And what's happening now with research, a lot of the federal grants, well, this was years ago, that they require you to have evidence-based stuff. But how do you get evidence-based stuff if you don't have a chance to look at nonprofits that are doing that kind of stuff? So that would be, but I think there needs to be a campaign to say, we're not bad people. Research, and I'm just telling you because people in the community think you are. And how can we, have another face that people will realize that they can really be in partnership with people. And it's not because people are getting their PhD and they get their dissertation and they say bye-bye, see you later.
And I think that's why, one of the reasons why we want a community hosted environment, so that we can ask questions. I'm not a researcher, again, as I shared, I'm nowhere near it, I'm a community person. Right?
But you got that, but I don't know that you're expert in knowing that kind of universe. And I think people don't even know that universe. You see what I'm saying? And you bring that expertise, even though you're not a researcher. I don't know, you told people all you've been at Johns Hopkins and all that other. So you bring a sense of credibility that I think people would be interested in hearing from you, because usually when people come out, they don't have any credibility based on their experience in our community. So I think that, you bring a credibility that because people usually say, we're not interested, or we've had negative experiences. But now with so many federal grants and requiring people to have researchers, they're looking, people are always trying to figure out how they can get people.
Who can they partner with?
Yes.
Exactly.
Yeah.
And that's what it is. But I think before we get there, it's like, how do we define what we want to research, we want to study? And we haven't known that. But I think that's part of the goal of this as well, is to find community-minded researchers, right? Who wants to work with us or understand it. But how, who are teaching us, how do we recognize that we're already researchers and that our programs that we're doing are interventions?
Yes.
Right? But then, how do we bring in the researchers? Which brings in those extra dollars, right? That we need because you understand the population and to drive real change.
And legitimate, because the problem is I remember, I'm retired, praise the Lord, and I don't have to deal with that anymore. But I remember we had to get people that were, they looked at, they could do legitimate. And they would, we had to get evaluators and researchers that people said, okay, they're approved. And what does that mean? And what we might need to begin to do is get young people to begin to think about it as a field. Because I think, like, for example, librarians, people don't think about, but librarians, they're begging for them. And there are not a lot of 3 librarians retired or left our community, and no African Americans replaced them. And because people think about librarians, unfortunately, you got the old sense they're older women and they don't, but the information age librarians are needed. So that, beginning to get young people to think about, that are naturally inquisitive, that might be something, because, I mean, who thinks about, you think about medical research, but you don't think about social research, which really, and people use it all the time to define who we are and what we do.
That's it. Absolutely.
Can I just
How we
make,
tell our own story and redefine it. And that's really, that's it.
can I just make
Well,
one quick
This is
comment?
really good. I'm finally I'm back in you. Well, that's
Can I just make one quick comment?
great. I apologize to people online, but I know Dr.
Your
Tran
name?
is still online. If we haven't seen your chat, I'm really having a lot of technical issues. I'm going to go and get a new laptop when I leave. Right? I don't know what's happening. But thank you so much for joining October's Beyond Gift Card Conversation. Again, we are looking for anyone who's interested in serving on the Research Advisory Council. Please share any ideas, any topics that you are interested in learning more about. I would love to get your feedback. You have to share your evaluation, we'll send it out. On this session, how useful it was to you and your work. And then Dr. Tran has left her contact information for you to kind of hear the QR codes here. And she will come back to disseminate her findings to us, so she won't be one of those. So we are excited. Thank you again, and have a wonderful, wonderful day. Thank you for attending.
Thank you all.
Can you send this to us electronically?
I will, yes. I have a list